This policy comes from California and it's a Children's Partnership National Black Women's Justice Initiative. There'll be 3 presenters. The first one is Angela Vargas. Currently, Angela is a policy director at the Children's Partnership, covering portfolio that includes mental health, child's welfare, and recently appointed to the California Citizen Redistricting Commission and an independent body tasked with redrawing California's election boundaries. Next, we have Dayanara Ruiz. Dayanara Ruiz works with the mental health policy team of the Children's Partnership with the goal of ensuring children and youth have their social and emotional health needs met in an equitable and holistic manner. Last but not least, we have Dr. Sydney McNee. Dr. McNee has over 15 years of experience in the areas of child's welfare and justice reform, developing and managing research and evolution in applied settings. So thank you so much. I'm really excited to see your presentation.
Hello, my name is Diana. Thank you so much for the introduction and the time to be here. I'm from the Children's Partnership, and we are presenting today alongside the National Black Women's Justice Institute, and we have 2 spectacular youth leaders from our Youth Policy Council that will also be speaking today. And this presentation is about our youth-centered mental health strategies for hope, healing, and health.
Great, thanks so much, everyone. I want to just introduce our organization very quickly. We are the Children's Partnership. We are a California-based children's health equity organization, and we advance child health equity through research, policy, and community engagement. We're so happy to be here. And then next, Sydney.
Hi, everyone. My name is Sydney McKinney, and I am the Executive Director of the National Black Women's Justice Institute, which is a national nonprofit that does research, evaluation, advocacy, and capacity building in order to end the systemic criminalization of Black women and girls. So very excited to be here to talk about the work that we did with the Children's Partnership.
So a little bit of agenda setting really quick. We're going to go through setting the stage. What is the Hope, Healing, and Health Collective, or as we call it, the H3C Collective, an overview of the policy recommendations that came out of it. And then lastly, youth leaders. So our youth leaders will be sharing their experience and reflections of what it was like to be a part of this collective, but also the process and their learnings.
Sorry, that's me. Thank you, Dayanara. So before we jump into our work, I want to first lift up all of the amazing partners we had in this project together. So we worked with 15 different nonprofit organizations from across the country that all applied to be a part of this partnership with us. Ultimately, we selected the folks who are on the slide. So the Chicago Freedom School, Justice for Girls, Black Girls Smile, Las Fotos Project. There are so many of them. I'm not going to name all of them, but I do want to say thank you to everyone who supported this work. We really couldn't have done it without them. And ultimately, we identified 15 organizations, which then identified 15 young people that they work with, our youth leaders, and together we created this policy agenda. It was a very participatory, iterative process where we really worked very closely with the young people who really drove the process. I think that we created a container in which to kind of like hold the process, but the young people, Adria and Samantha are 2 folks who were part of the group, will tell you more about it, but they really drove this process of identifying what were the key issues that we needed to address in our policy agenda, as well as what were the ways in which we wanted to really kind of push forward as our advocacy to do that. So the first, Yeah, so, and one of the ways that we did this was through listening sessions. So I hope that the young people enjoyed it as much as I did, because I love a listening session. But our young people identified their peers. We had about 40 young people participate in these listening sessions that were co-led by our youth leaders. The youth leaders were really at the forefront of determining what the questions were and really leading those conversations. The adults in the room really were there as a source of support, and the young people really kind of drove the conversations that they had with their peers, which were really the foundation of our deeper learning and around what were the issues, which were access to services, experiences getting support, barriers, fear, and stigma, the role of schools, youth-defined non-clinical supports, and also the impacts of family and culture. And so those were the issues that they identified, and then we came up with a bunch of strategies, or they came up with a bunch of strategies.
Yeah, so I can go in a little bit deeper into some of the issues, as well as the policy solutions that the young people developed. So when we talked about access to quality care, we really heard pretty loud and clear from young people that some really key issues around just being able to access mental health services was the lack of diversity among mental health professionals, that quality services really cost a lot, and that is a huge financial burden on youth and their families. And we heard a lot of mixed reviews about virtual services and, virtual online therapy. As a note, we engaged our young people, this Hope Healing and Health Collective, in the first year and a half of the pandemic, and most, if not all, of our young people were for that entire time doing distance learning. And so I think that really impacted young people's experiences of engaging virtually with adults, with services, with everything. And so in terms of finding solutions to these issues around just getting basic access to mental health supports, the young people really wanted, of course, us to address the diversity issues within the mental health field, so that people can young people can actually talk to someone who looks like them, who has had, similar experiences to them, comes from their communities. There's also just a lack of knowledge around how to access mental health services, whether it's through insurance or just out in the community. And that young people really struggle with having adults, whether it's parents, teachers, campus administrators, really struggle with finding a safe adult who can help them navigate the very complex and foreign system of mental health care. And then, of course, finally, we also just got feedback really that young people wanted to have online supports and in-person supports, that there was definitely a mix of how folks wanted to access mental health care. Next slide. Great. And so this is also an extension a bit of access to care. So what we also heard from young people was that, what we think of mental health care doesn't always necessarily meet their needs. And I think especially also as a note, I believe all of our 15 youth leaders were young people of color. And the important thing for them was that, connecting with culture, connecting with elders, engaging in community rituals, really being able to center their healing on their racial and ethnic experiences from, marginalized communities was really important to them. That is healing, that is transformational. Just because it's not therapy doesn't mean it's not therapeutic. And so we really heard from young people that, the way that our mental health system supports them needs to be much more expansive and include more culturally responsive forms of care. And that sort of looks like these two very similar but distinct policy solutions around, expanding what our systems consider mental health care, and then actually, making sure that people like health insurers pay for that, as well as building the capacity of young people to support each other through peer support programs. And that's, you can go to the next slide.
I can talk on this one. One of the other areas that both Sydney and Angela have mentioned is the importance of family, race, and culture, and how that impacts youth and their development and their mental health. So there were 3 areas that they found barriers within. One was there's the heavy stigma and the lack of community and family awareness surrounding mental health, specifically in communities of color. It's just not a conversation that really tends to be talked about. And we had youth even talking, Latinx youth saying how machismo and talking about these cultural aspects that really do hinder their ability to be able to communicate with their family members what is going on. In addition, there's also unmet mental health needs of family members and household members. And we've seen through the years just how much generational trauma can impact the entire family. So that was one of the other barriers. And lastly, the warranted mistrust of the mental health system. And in the US, we know that people of color have not always been treated equally and fairly and justly. And there is still that mistrust in this healthcare system. The policy solutions that came out of this, one was to create policies that could ensure that BIPOC youth and their families all receive care and treatment rather than just heavy surveillance and discipline, which we often see, especially in communities of color, how they are usually met with discipline rather than being treated for a mental health condition. They also want to create and maintain safe spaces where youth in our group, particularly girls, transgender youth, and youth with immigration status concerns, could feel safe and be vulnerable and open and talk about all of these issues without the fear of there being backlash or there being their parents' immigration status could hinder their care, their ability to receive care. We also wanted to reduce the impact of family cultural stigma by including family engagement and community education. They wanted their family members, their parents, to be involved in this. They are taking in on this learning and growing and wanting to educate themselves on mental health needs, but they also want their communities to learn this and their parents. And lastly, to ensure that whole families and households receive adequate and culturally responsive mental health care. Again, there is a lack of diversity, and they want to make sure that they're not just themselves, but also their family. Everybody feels comfortable sharing and in a space where they are heard and understood.
So I'm going to talk about 2 other areas for policy recommendations. The first is school-based services. In the listening sessions and from the youth leaders that we worked with, we heard that there was a lack of sufficient access to adequate school-based resources, including programs. And so one of the policies, so I'll actually say that that's also a concern because data show that most young people access mental health services from schools. And so if there's this sense that school-based services are not adequate, there is then this concern that there are so many young people who are not being able to access services that are much needed at the place that they are most likely going to try to gain access to those services. So one of the solutions, the primary solution that we identified, or the young people identified, was that there needs to be a lot of investment in increasing school and staff capacity. So as we heard earlier, I think this includes making sure that there are mental health professionals of color in schools, so that young people feel like they're able to connect with people who come from similar backgrounds and communities. It also means investing in training for educators so that they better understand, have a better understanding of mental health literacy and what are young people's needs, and can be responsive even in the midst of feeling quite overwhelmed by the kind of workload that they have. And then I think there are other areas to address, including, administrative concerns, programmatic, making sure that there are both clinical and non-clinical programs. And I think also school policies are really important and fall under that banner of how we can increase schools' capacity to support the mental health needs of youth of color. Then the other area that we identified was youth engagement. So one of the main barriers, and I think the reason why we are actually here together, is because young people are really not centered in discussions around mental health policy or any kind of school-based policy, or any policies, period, that impact their lives. And so we really heard from young people that they wanted to be able to co-create the different kinds of opportunities, the policies, the interventions, the programs that they would benefit from. And so, I think the obvious solution is we need to create space for young people to be leaders, and that we need to listen to young folks. I see you, Samantha, nodding your head, right? That like we need to be listening to young folks about what it is that you all need, because and to really engage you in developing that. And so that's really, I think, the importance of youth engagement. If we are going to create things, policies, programs, and interventions that are going to be most useful for young people must not just be at the table, but they must really be driving the ship as far as what that looks like. And so from a policy perspective, making sure that there are those opportunities for young people to lead was another thing that really came out of our conversations and one of our prime recommendations as far as how do we engage young people in this work moving forward.
So beautifully said, Sydney. And now we are actually introduced to you two of our Youth Policy Council leaders. They are amazing. And even though we've already shared what this project was, this project really was with them and because of them, and it was their ideas, and we just gave them that space. So what better way for us to explain this to you than for you to hear it from our youth policy leader. So we have two amazing women with us today, Adria Marin, who is from Las Fotos Project, and we have Samantha Giles from the Black Girls Smile. Samantha, I'm going to pass it on to you now.
Okay. Hi, thank you for that introduction. But following what Sydney said, I think the H3C really provided us an opportunity to really lead and really talk about our mental health. And basically with this opportunity, I got connected with it through Black Girls Smile, which is a nonprofit organization specifically uplifting Black girls and Black women's mental health. And with the H3C, we met, I think, once a month, twice a month, but those little Zoom meetings really became my safe space because we were able to talk about our mental health in a safe environment. We came up with guiding questions about what to ask other youth of color, specifically pertaining to their mental health, and also what resources they needed, whether therapy, whether they wanted therapists of color or just therapists in general. And we were able to have guiding questions and then conduct the final, listening session, which was a big success. And it was so amazing to hear from youth, not just in my area, but from across the country. And after the listening session, we were able to publish a policy agenda report. And that was it's an interesting experience being able to really create not necessarily a list of demands, but suggestions as to what can better help youth of color's mental health from youth of color. And I'm grateful for H3C for providing like that space to really be ourselves and give us an opportunity to lead. So yeah, I'll pass it back to Dayanara.
Thank you, Samantha. I very much appreciate your words. And I know everybody else on the panel does as well. And now I will introduce Adria.
Thank you, Dayanara, for that introduction. And hi, everyone. My name is Adria, and I'm from Los Angeles, California. For the past 4 years, I've been affiliated with and taken photography classes at Las Fotos Project, which is a nonprofit organization geared towards educating teenage girls and gender-expansive youth within the arts and elevating their voices through photography. So Las Fotos Project has 3 branches of classes, which include self-expression, advocacy, and career-based curriculum. And through their guidance, I've had the privilege to conduct photography work for the Academy Museum of Motion Pictures, Angel City Football Club, and the Los Angeles Times. I began my advocacy work in my first class with Las Fotos Project, which was centered around folks who are fighting ageism. And so for this assignment, I chose to highlight my aunt. She battled breast cancer, is now in remission, and she now dedicates her time towards advocating for breast cancer awareness, which includes attending and volunteering at 5K races yearly. Despite her hardship, she always maintains a smile and she brings light into every room that she's present in. So I really admire her. And through this class, I grew inspired to take action against her. Sorry, I'm at school, so that's the bell. Through this class, I grew inspired to take action against stereotypes and fight discrimination against minorities and underprivileged groups. And so it was my participation in Las Fotos Project, as well as my advocacy work, that led me to join the Hope Healing and Health Collective. It was truly inspiring being a part of this collective, and I was greatly moved by the knowledge and the experiences of both my fellow youth leaders, as well as those who joined our listening session. And it informed me that many disenfranchised teenagers experience similar struggles in their mental health journeys. I joined each Zoom meeting feeling safe, and I left each group conversation feeling eager to continue advocating and motivated to continue fighting stereotypes in hopes of drafting the ideal mental health resource. Having experienced the flawed mental health system firsthand and enlightened by the experiences of those around me, I have noticed that there is a need for reform. From financial barriers to a lack of diversity among professionals, scheduling conflicts, and citizenship status, various reasons prevent adolescents from seeking mental health assistance, which both affects them in the short term and in the long run, leaving conditions to worsen. It is extremely important to ensure that everyone, especially the youth, feel supported and secure enough to seek out the help that they need, and that the resources are accessible and available. For example, at my high school, they just created a wellness center with mental health professionals present. However, students are pulled from classes in order to attend appointments, and so they may fall behind in class, and then that can worsen their mental health, which just creates a spiral. But mental health care should be available and accessible to everyone. Especially among BIPOC adolescents, cultural traditions and family stigma create barriers between them and mental health services, which is why gender and identity affirming, as well as culturally affirming services are important and must be widely available, as traditions and experiences should be embraced rather than leading to incorrect diagnoses. With our findings from the Hope Healing and Health Collective, I hope that adults with authority in the government in regards to policymaking will take into account youth voices and our experiences in making youth mental health resources. Thank you so much for your time, and I'll pass it back to Dayanara.
Thank you so much, Adria, for those beautiful words. And thank you again, Samantha. I think both of you said it beautifully and eloquently. There is a big need for investing in our youth and providing all youth with appropriate culturally affirming mental health resources. And for part of our policy recommendations, we created action steps. So we have our policy recommendations, but we also had action steps that we created collectively with our youth after we figured out what were our policy recommendations. But how do we get started? What are things that we can start doing, and what are the suggestions? And these are 6 suggestions that our youth came up with. So one is advocacy capacity building. So really investing resources, training, mentorships for our youth and marginalized community to be able to increase their ability to become community organizers, to become advocates, to be able to adapt and implement youth mental health advocacy in their communities. Another one is tied to that. So community organizing, building the strength and the relationships of the communities that are most affected of our communities of color, and making sure that they can come together and advocate for themselves. The third one was increasing knowledge. There is a need to spread greater awareness and mental health education to all of our communities, and mental health looks different depending on the community that you come from. So being able to increase this knowledge. Fourth was influencer education. We know that there are people in society that have greater impacts and that have a wider range of voice when they speak, and making sure that the influencers and our BIPOC influencers are also educated on these topics and bring these topics to light. Fifth, changing the attitudes, which is easier said than done, but we know that it is important to change the attitudes and the beliefs, especially of the people in our communities that are in positions of power and influence. And that leads into number 6, so increasing the political will and support, making sure that our elected officials are also educated on these issues, but also have the need and the desire to want to support our mental health and our youth and their mental health, and provide solutions that we're all advocating for. And the next slide, I will pass it to Sydney.
I did, and sorry to jump in here, Dayanara and Sydney, but I did just also want to acknowledge and send a huge thank you to our friends at CLASP and the youth leaders who helped us develop those action steps. So we had this really great, set of ideas and policy ideas, and CLASP came and presented to our young people and helped us think through sort of how do we get these policy solutions to come alive in our communities. And so those, what you'll hear next from Sydney and myself is how we put those action steps sort of into play.
Thank you, Angela. So one of the goals we had at the outset of this project was to not only support the advocacy and leadership of young people, but also to build the capacity of the organizations that support them to continue to do advocacy work, particularly focused on mental health. And so we're excited to share some updates from us as well as our partners. So I will first start by saying at the National Black Women's Justice Institute, we have just launched what we're calling the CARES initiative, which is creating, affirming, responsive, equitable schools. And it's really inspired by so much of what we heard in these conversations about the need for schools to be spaces where young people, particularly young people of color, can feel like they're supported as far as their mental health and wellness. What we are doing is creating an assessment tool that schools can use, and we're doing that in collaboration and partnership with a youth council of Black girls and gender expansive youth, so that this tool is intersectional and also really centers their needs and experiences. There are organizational assessment tools that exist, but they are not organizational assessment tools that are created by Black girls and gender expansive youth. And so we're really excited about that work that we are doing. Our partners, Justice for Girls, recently put forward a legislative policy agenda and even proposed some budget proviso is that how you say it? I think that's how you say it, to the Washington State Legislature that would increase funding for their Girls Advocacy Impact Network program, as well as their girl-centered anti-bias training for public systems caregivers. So both of those have unfortunately died, but they're going to revive them in the next session. But in addition, they have shared three recommendations. One is to improve and expand the prevention and diversion and discharge services for girls involved in or at risk of becoming involved in public systems within Washington State, as well as promoting safe and inclusive school communities for girls. And then also to address the mental health crisis of girls using a racial equity lens. So those are their policy agendas, or their policy agenda. And then, oh, we have a typo. Detroit heals Detroit. Oh, there are lots of Detroits in there. Did you? And so Detroit heals Detroit is opening its doors to their youth-led healing hub on May 21st. It is a community-funded project, and that space will amplify culturally rooted trauma-informed care, wraparound services, and use transformative justice practices to help students experiencing recurrent trauma, specifically young people ages 12 to 21.
Great. And our last two updates here around policy, putting policy into action. So this past year, the Children's Partnership, together with some additional amazing youth leaders from our partners at the California Children's Trust, were successful in getting California's legislature to approve a $10 million investment in high school peer support. So the Children's Partnership will be the state administrator for this new $10 million pilot demonstration. And we will be essentially putting out a grant for 8 high schools across California to help them develop peer support programs on their campuses. And at the end of those 5 years, we will submit back to the state a set of recommendations about how to scale peer support, high school peer support across California. So we're very excited to be able to putting that policy recommendation around increased peer supports into action. Additionally, I had said earlier that we heard very loud and clear from young people that adults aren't always perceived to be safe or effective ways to obtain mental health care especially in a timely manner, especially for young people who are LGBTQ, for young people who have had negative experiences or experienced stigma within their families. And so here in California, the Children's Partnership is supporting a bill, Assembly Bill 665, which would expand access to minor consent services, which basically means young people are allowed to consent to their own care without having to get parental consent. That is true. Young people in California, ages 12 and up, can already consent to their mental health care. However, low-income young people on Medi-Cal face additional criteria that their higher income peers do not. So we are running a bill to help fix that issue and hopefully expand access to more mental health care for young people who need it. And then finally, our friends at Las Fotos Project is investing more training for its mentor base so that they can better support the students in their program who need mental health support. They're also working on creating a team plan as an organization for supporting students in a mental health crisis, including establishing staff guidelines for creating safety plans with the student. And they also, to ensure that the young person has agency in how the organization supports them moving forward. And then finally, Las Fotos project also is planning to map how students are experiencing strained mental health issues and how they can communicate those needs to staff so that they can adjust their programming accordingly.
Thank you. And we now open it up to questions. So this has been everything we wanted to share out with all of you.
So much for your presentation. Before I open it up to panelists and the audience, my question is, how are you assessing the impact in terms of policy change?
That's a great question. I can start that answer, and then maybe Sydney and Dayanara, if you want to add. So in terms of measuring impact, we have this great youth developed policy platform. And as we shared, we are sort of in the midst of trying to make those policy recommendations come alive. And so we have been sort of really using qualitative data, keeping in touch with our collective partners, our organizations, to see how they are implementing those policies in their communities. I will say that sort of the longer term vision for the Children's Partnership, especially in our work here in California, would be to start to see some movement on some of the long-term outcomes for youth mental health. So for example, here in California, young people have experienced a huge increase in suicide and emotional distress. And in particular, if you dive into that data, we have seen that girls of all races and ethnicities and Black youth of all genders have really experienced an even greater increase in the number of suicides. And so I think for the Children's Partnership and our work in California, we would feel like we are moving the needle on these policies, maybe in the next 3 to 5 years, if we could start to see at least some of those gaps, those disparities between young people from marginalized communities and their peers, if we could start to see those gaps close, and that overall we would start to see both, negative outcomes like suicide and unmet mental health care needs be eliminated.
Thank you for your presentation. My question is about I'm curious to know what the plan is to ensure that these recommendations and action steps are both scalable and accessible in organizations outside of the nonprofit space, and also in places where there have been recent attacks on the sort of gender and culture affirming care that are proposed in a lot of these recommendations.
So I think that's a great question, and I think the one thing that about our work together is we have come together to create this policy agenda, and our respective organizations are really figuring out how they take on pieces and bring it to their own communities. And so I think it really looks very different. To your point about how we're trying to take on the issues of gender responsivity and culturally affirming mental health services in this moment when those are topics that are under attack. I do think about the work that we're doing at the National Black Women's Justice Institute, where despite that, we are trying to find school partners who care about this, who will support us in even piloting this assessment tool. So even in this, this moment where these issues are under attack, there are people who do care. And so I think it's to bring our work and help other organizations take up these recommendations is really to find more partners beyond the organizations that were part of this work. And I know that we're doing that in our different ways. So I actually really appreciate this question, both of these questions, because so much of this work was setting the agenda and wasn't so much the what's the next step for all of the organizations. And it makes me think, that's just another step of our continued kind of engagement. Why we're checking in with each other is how are you moving forward? And even kind of creating that space where people can continue to connect around their work, which is happening, but we could be more intentional about supporting folks and carrying that forward.
Hello, starting out, I would like to say that I definitely enjoyed the presentation today. Mental health is a very taboo topic, specifically in the BIPOC community. I'm curious to know, did you face any pushback from community members with the implementation of this policy?
I would love to hear from either Adria or Samantha. Did either of you experience pushback, whether, when we were inviting folks to the listening sessions, or maybe in sharing about what you were working on with the H3 collective?
I guess I can go first. So I'm from a small town in Virginia, and it's mainly conservative. So usually I think one of 5 Black people in my specific center class in my grade level. So there's a lot less, I guess, concern or care about, BIPOC mental health in general. I guess pushback in the form of just people not wanting to participate as much, but no verbal or physical assaults. But there's, I guess, a lack of urgency. However, I'm grateful for my community because even though there's a lack of urgency, they definitely wanted to hear what I would be saying. They wanted to really listen and try to understand, because it's not a perspective that they're really hearing from normally. So yeah.
Thank you.
In my community, oh, sorry.
Oh, you're fine. Go ahead.
Okay. In my community, so I'm from a suburb of Los Angeles. So it's primarily liberal, I would say. So there wasn't necessarily pushback when I was, I guess, recruiting or listening session. However, I feel like there's a lack of knowledge in regards to mental health as a whole. Yeah, but there's not much pushback.
Yeah, thank you so much for letting me put you both on the spot. I did just want to also answer your question, to note that even in California, so I talked about our Assembly Bill 665, which would allow more youth, especially low-income youth, to consent to their own mental health care without having to go through their parents to get mental health care. It's pretty well known that California is a really progressive state, a really liberal state, and yet we have gotten pushback from folks who we would have assumed would be on our side, who would be in favor of expanding access to mental health care for young people, because adults have bias, and adults have bias against young people being able to, make these kinds of decisions and pursue their own, pursue their own care, their own health care, their mental health care. And of course, we also, I'm older. I'm not that old, but I'm older. I get the sense from from parents who are liberal, who are progressive, that, they want to support and help their teenager navigate a really complicated system that is mental health. And at the same time, I think it's hard for adults to accept that maybe not their teenager might not view them as a safe person, even if they really are. There's just so much fear and stigma in our communities, as you said, that I think that really we're having to have some important conversations with adults about how much we need to be able to trust young people to make these kinds of decisions for themselves. And that's really hard, as you said, in the BIPOC community, especially.
But despite the pushback that some of you have received, thank you for being the change that we all wish to see in the world.
Hey, y'all, I also just had a question. First of all, I am in awe with the work that you are currently doing and that you plan to do in the future. This has just warmed my little heart up today. So policy can be such a heavily charged environment to navigate and such. I'm just I love the nitty gritty. What got ugly and how did you manage and how did you get around and work with that? Because policy is tough.
I don't know if anything, and Samantha and Adria, you should definitely jump in if you disagree or even if you agree. I don't know if in our collective things got ugly. I will say that I was educated quite a bit by the young people and our organizations, in particular about challenging my assumption that every adult in a helping profession, in a helping role, in a school role, is necessarily a safe space for a young person to go. And I think, especially in our conversations, it was really important for me to hear and internalize that, the experiences, particularly of, Black youth and other youth of color, when they experience distress and they get sent to detention, or they get campus police called on them, when the same scenario for a white youth would be treated very differently. And I think I knew that, I sort of knew that conceptually, but it was really important that we had some of those conversations in our collective, so that we were all sort of looking at this issue from sort of 360, right? That yes, there are adults who are safe spaces and we need to connect young people to those adult allies. And we have to recognize that there's this both history and present practice of bias and surveillance and disciplining young people of color for their mental health and emotional issues. So that's I think is the ugly that is just happening in this policy work from my perspective.
I'd also just add that as far as our dynamic within the group, I don't think there was ugly. I think everyone understood that we were coming together for the same reason and have the same goals. And so we did this groundwork with each other where we built some trust. We also set some community agreements around how we show up and how we speak to each other, where it really, as both Samantha and Adria said, I think created a space. They created a space where they could feel safe, right? And so they could share and they could talk about their own experience without fear or concern that there was someone who was going to invalidate their experience. And so I think we really avoided the ugly by creating the shared mission and vision together that allowed us to kind of really, all of us, young people and adults, show up in this space as our best selves, caring for one another throughout the process. And I think that's why the report that we put together is so beautiful. And it really does reflect the brilliance and the leadership of the young people and their care for each other and for young people, nationwide.
Much.
I enjoy hearing about how you include youth from the get-go with the youth council. So I was wondering what was the selection process for the young people in the council and the listening sessions, and for any future plans, are you focusing on expanding to engage more youth and have the youth councils be more accessible?
Yeah, thanks for that question. So the selection process for the young people was left up to our 15 partner organizations. So we were, we were in the great position to be able to have resources. We granted the 15 organizations got money, which is not always common in policy advocacy work. We were able to support these organizations with grants, which also means that the young people on our council were compensated for their time, which was like awesome. And having done youth engagement, youth policy work, that's again not always the case. So each organization picked their youth according to their internal processes. And I can let Samantha and Adria share how they were chosen. And before that, I will just say also in terms of the future of our Youth Policy Council, so the council was time limited. We had a grant. This is unfortunately how many things in nonprofit world works. We had a grant. And so we were not able to sort of sustain the policy council long term. That being said, it particularly for the Children's Partnership, the process of hosting and facilitating this Youth Policy Council has absolutely informed how we plan to approach our advocacy around youth mental health. And we have kept in touch with our youth leaders like Samantha and Adria and their host organizations, and have really pulled them into our statewide advocacy. So while the Policy Council as a body right now doesn't really exist, our relationships with these organizations are absolutely alive, and we continue to sort of work together on these issues. So, and that for us is really exciting and important. And I know maybe Samantha and Adria, if you want to share a bit about how you got to be part of the H3C.
I guess I can start. So basically, I was researching, I think it was 2020, and I really wanted to find mental health resources made for me by people that looked like me. And that's how I got in touch with Black Girls Smile. And I'm very close with the CEO. Her name is Lauren Carson, and she's been so instrumental in just helping me navigate my mental health and help advocate for Black girls' mental health in general. So she introduced me to the Policy Council and to the H3C. And then with that, I was able to do the meetings and have my involvement in this organization. But I guess like with getting people to come to the listening session, I really just tried first at my school and then really like branched out. I talked to my little sister's friends. I talked to my friends. I tried to get as many people as possible to come and join, especially from I wouldn't say it's necessarily like conservative, but a smaller Virginia town, just to get more and different perspectives on mental health. So I really tried to outreach to all parts of my county. So the rural, the very rural parts, and then the urban parts as well. So that's how I got people to join. Yeah.
I'll go next. So at Las Fotos Project, I've been in the Youth Advisory Council for the past 3 years. So I think I was like ending my first year in the Youth Advisory Council, and I'm close with the adult leader of the Youth Advisory Council, whose name is Alana. And she was aware of like my own mental health struggles, as well as my past advocacy with like ageism and women in sports, etc. So she felt that I was a good fit to join the Hope Healing and Health Collective. And as far as recruiting folks for the listening session, I was branching out within Las Fotos Project. So I just kind of put it out there like on Instagram. I was like, hey, if anyone's interested, like you can come to my listening session. And yeah, so that's just like how I went about it.
Just to add on to what both Samantha and Adria said, so our youth leaders were the ones that did bring in their peers. Us on the leadership team really just helped provide. We created the flyer for them. We asked if all of the youth to invite 2 to 3, and some of our youth invited like 5, 6. So really we ended up having a great number of youth join our listening session, greater than the one we'd anticipated, because of the excitement and the advocacy that they did on their part.
Answer. It was really nice to hear about how you guys cultivate relationships with the youth council.
Thank you so much for the work you've done and continue to do. When I was looking at your application as well as reading the data y'all provided, I felt validated. I feel like a lot of my peers, like I'm the project, I have my own club at my school, and in my club, I focus on mental health and emotional intelligence. And a lot of the struggles that my peers face was like addressed in this, and I really am so grateful for that. And I look forward to seeing all the work you continue to do. Yeah, thank you.
Can I just say thank you so much for sharing that? All of you were incredible. But I think what you just said is exactly what we hoped people would feel, you all would feel. And I think that is, just really a testament to how much young people led this process, right? That you saw yourself and what you were experiencing in that report is because it was created by you all. And so I just want to say thank you to each and every one of you, and thank you so much for sharing.